Mhm. Thank you. Contact. Am I on mute? Yes. Alrighty. Oh, come on, I don't want that. All right. Am I okay with the screen? Yeah, I think I'm okay. Maybe I should lower it a little bit. All right, guys. Y'all are getting me as a surprise because it was a very busy day. But I'm here with all of you. So, um, it's going to be an open forum. So, whatever y'all want to talk about tonight, whatever questions y'all have, we'll just go over them. So, yeah, it looks okay. Hi, Daniela. Hi, Martha. Thank you for joining me. So, I do have a question that I'm going to go over, which is about the degrees. Like, people get degrees because they think that they need degrees to be medical coders, and you don't. You don't need a degree to be a medical coder, and I'm going to talk about that tonight. Hi, Gabriella. Hi, Crystal. Thank you all for joining me on this Thursday night. I was running. That's why you see me so scattered. All right, so we have a quorum now. I guess I'll go ahead and get started. If you are brand new to my hold on. That's better. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, if you are out there and you're thinking that you would like to be a medical coder, and maybe you're going to the college and the college has a medical billing and coding program, and they say, oh yeah, by the way, you should get into our associate's degree program, and that way you'll make even more money and they will want to hire you because they only hire people who have degrees. This is not true. Medical coding is one of those really weird fields in that you don't have to have a degree in order to be very successful in this career field. Now, yes, there are some times when, after you've been in the field for a while that you want to get your degree. That's something different. But if you are just brand new and you're saying, well, I just want to do coding, then just concentrate on that. And that way you can see if you want to get a degree. Because getting a degree is an investment of time, energy, money, and you want to make sure that you are using your time wisely and that you're doing it for a purpose, okay? It's not just going to be an expensive piece of paper that you own. I feel like I still have a hair somewhere on my face. Okay, so you don't want it to be this expensive piece of paper that you have. So you want to make sure that when you go to school for health information technology or health information management, that you are going for, see, there is something on my face. It's my hair, but all right. You want to make sure that you're doing it for the right reasons. And the reasons that people get degrees is because they want to be in leadership or they want to teach. Those are mainly what the degree holders are for. Now, before somebody says, well, no, Blue, at my hospital, we only hire degree holders. I know that's not true. Because if you look in the job listings, a lot of times they'll say, we would like somebody who has a degree or a medical coding certification through a HEMA or AAPC. So that's the thing that you have to really look at. Yes, employers are going to look at degree holders like, oh my gosh, they have a degree. But that does not translate into they're going to be an excellent medical coder, because the whole thing with the degree programs is actually not coding. The coding portion of those programs, the registered health information technician or the registered health information administrator, the health information technology degree, the associate's degree, or the health information management degree, the coding is very small. It's actually just like a couple of classes and then that's it. And so that's not really something foundational for you to be like, oh yes, I have this degree and so I know everything there is to know about coding. That's not true. And you can do that with just having a certification. And a certification is going to be a fraction of the cost of a degree. However, there are really good degree programs out there, particularly for the RHIA. The only one that I recommend is in the description box below. So if you want to see the school that I recommend, the link that I have there is just my affiliate link. But you are under no obligation to sign up for the school. It's just for more information on your part. Okay, good questions, good questions. I will get to your questions in just a second, Patrice. When you're considering getting a degree, consider only if you want to lead people, because again, the majority of what they teach in those programs is about the law, it's about ethics, it's about people and managing people and things like that, statistics. That's what it's about. So if that's not what you want to do, if you don't want to teach, if you don't want to be anybody's boss, then don't pursue the degrees. Now, I'm all about higher learning. I'm all about like people getting educated. But when it comes to medical coding, if you are coding with an RHIA or an RHIT, coding like regular clinic coding, you are technically working under what you should be with those degrees. And with that translates the money as well. So don't expect to, just because you have a degree, that you're going to get paid more than coders. No, because when it comes to the money side, and you know, we don't do money and specifics on this channel, but what I will say is when you have a degree, it doesn't necessarily mean that you're going to make more than somebody who just has a certification. I know because I have outpaced people who have an RHIT and an RHIA. So with just the CCA is what I had. But the reason that I got paid more was because I have more knowledge and I could prove that knowledge, whereas the ones with the degrees couldn't because they were still new, or that wasn't what they did and that wasn't really kind of their focus anyway. So that's something that you have to know. Having a degree does not translate to more money, and save yourself the money, because whatever these recruiters are putting out there and saying that, oh yeah, you need a degree. Somebody commented the other night that they got a degree and what are they going to do with it? The degree that they got was in like health information, but it wasn't health information technology and it wasn't health information management. So it was something completely different. And essentially it's no good for what we need as far as like RHIT or RHIA. And so that's unfortunate because that's a lot of money that somebody spent to get a degree that what are you going to do with it? Other than try to be somebody's boss. But then if you're going to do that, then they're going to be looking for the RHIT or the RHIA. So be careful when you're out there selecting those programs. The Commission on Accreditation for Health Informatics and Information Management, I got it right. I got it right. They are the ones who approve the schools. So before you sign up for a school and before you ask the recruiter, oh, can I sit for the RHIT if I'm going for the associates, or can I sit for the RHIA? Make sure that you do your due diligence and you check it out yourself. Go to CAHIM. I will leave the link when I update the video, but I will leave the link in the description box. But go to CAHIM. There's a section where you can click on to see if your program is approved through them. And so that way you can know if you're going to be eligible to sit for the RHIT or the RHIA. And again, you want to make sure that if you're going to invest that kind of money, that you want to make sure that everything is all checked. The program that I recommend that's in the description box is approved to be able to sit for the RHIA once you have completed your program. And that is what I love. So that's something that you got to know. I mean, again, that's the one that I know for sure that they do approve them to sit for that exam once they've completed their program. All right, so let's see what we got here. So Miss Patrice, thank you so much for your questions. Hi, Blue. How do I feel confident in my coding when I am an inpatient coder? I've been looking for work after school and I finally found a job as a referral coordinator. Uh-oh. Can I go back to coding later? You might want to go now to coding. Patrice says, I went to a junior college, got a certificate, but I just found a job then, and now I see more entry-level jobs. It makes me even more excited. It took me 6 months to find work, and I wanted to stay fresh. Okay, so what I will say about referral coordinator, while referral coordinator is a much needed job, Please hear me when I say this, because I don't want anybody getting upset, okay, for not listening to what I just said. Referral coordinator is very important. Without them, I mean, it would be anarchy in those clinics, okay? We need referral coordinators. However, if you have a medical coding certification, that is one of the number one jobs I tell y'all to stay away from. Why? Because what you do as a referral coordinator is not going to transfer. You're not going to have very many transferable skills to get into medical coding. You want your time to be for something. Now, I know you just got this job, and that's great, and maybe that's your foot in the door to get in, you know. Some people have, and some people get stuck there. Don't get stuck there. If you stay there, be there for 6 months and then move on if that's what you want to do. Or if you want to stay there, that's totally fine. But what I'm saying is this: what you learn as a referral coordinator is not going to help you when you're becoming a medical coder. Now, if you had gotten a job as a medical biller or a prior authorizations specialist, those have transferable skills to medical coding. Medical billing, number one, because you see the codes. Even though you don't code, you still have to talk to the insurance company, and you still have to find out why they're denying these claims, and then you have to send it off back to the coders, and so you're doing a lot of that. So you're seeing a lot of the action, even though the stuff is already coded, but it's giving you those transferable skills, because yes, now you know what it looks like to have these procedures and modifiers and evaluation and management. You know about all of that. Plus, you know about dealing with the insurance company, which again is all transferable on your resume for your medical coding job. Oh, this person's been a medical biller before, now they're going over the coding. This is a lot better than somebody who is just off the street and brand new, who's not coming in with transferable skills, okay? And with prior authorizations, you're seeing the note. You're seeing the note that the provider says, okay, the patient has this condition, that I want to do this procedure. Call the insurance company and see if you can make it happen. You call the insurance company says, well, this diagnosis does not support this procedure. And then you got to take it back to the provider and say, hey doc, they said that this does not support this. What can we do? And then they give you another diagnosis code or whatever else the patient's being seen for. So again, that's working with the codes, that's working with the procedures and finding out which diagnosis goes with which procedure. So that's what is transferable there. So that's prior authorizations. So two really good places for you to start with. And a lot of people will say, well, I want to try medical secretary or referral coordinator. And what happens a lot of times in those positions is if you get really good, or if you're in a secretarial position and the patients like you, you're not going anywhere. And they will make sure of it, because employers are greedy. If they have a person who does a really good job at whatever they're doing, and while it's important to do a good job at your job, you want to make sure that you are going to give yourself the opportunity to be able to advance. Now, while you may think, oh, I don't want to hurt this person's feelings because they gave me a chance and they let me in, it's still your career. The longer you're away from those codes, the easier it is for you to forget. And then by the time you know it, 6 months to a year later, when you're being tested again because you insisted on applying somewhere and you haven't been studying, and all of a sudden you can't answer those questions on that assessment test. And now it's a problem, because now you got to start learning all over again. So you don't want to go through that. That's why I say, if you're going to pick a alternative position to start in, then you want to pick medical billing or prior authorizations, or even it's not data entry. What is it? Charge entry. Charge entry is another really good little off the wall type position that you can get into, because with charge entry, you're working with the electronic medical record, right? So that's getting that electronic medical record experience onto your resume, on your hard skills, okay? So you get that onto your resume. Not only that, you're still working with codes. You have to accurately enter those codes in, and you've got to be able to accurately enter in the modifiers and everything else that goes with those codes. And even though you're not the one who's coding them, you still have to make sure that what is pre-selected is being accurately put into the system. So that's another thing that you can say there on your transferable skills. And it's really good because, okay, you don't have to be the fastest typer in the world, because it's literally just entering numbers in, and that's it. As long as you know your numbers and you can make sure that you do everything correctly when you're entering in, then you'll be fine. But that's, again, another position that you can go into. So hopefully that makes sense, Miss Patrice, and I hope you take my advice for what it is, just trying to help you out. um, all right. Giselle says, "Hi, Blue. I'm in that situation. I am a recent health informatics graduate, but can't get a job because my school is not accredited." Oh, that's horrible. P says, "Hi, Blue. My goal is to gain the most comprehensive knowledge of the revenue cycle. Do you recommend billing or coding or both?" So what happens is a lot of times people get that kind of confused, because sometimes people say, "Oh, well, this is our coder. Oh, so our biller coder." No, no, no. Sometimes medical billers are one person. One person does it. And then medical coders do something else different, right? They're their own person. Me personally, I have never done billing. I know a little bit about billing only because I'm nosy and I have to do my research on things, and I want to make sure that I know and understand. That's why I do my own research. I do when I'm here and I'm studying at home. That's when I start studying the billing stuff, because I want to make sure that I understand. And plus, on my Patreon channel, sometimes I get my viewers there who ask me questions about billing, and I want to make sure that I'm giving them good information. I don't like to say I don't know. That's the worst thing that anybody could ever say. "Oh, no." Did you try to find out? That's the thing. So I try to do that. So I try to keep up on all that stuff. But if you put me into a medical billing position, of course I'm gonna be able to pick it up. But like right now, I'd be like, well, let me try to figure my way. But when you're working as a biller, you're doing the billing side. But if they hire you as a biller coder, then you're doing not just the coding, but you're also doing the billing. So you're doing both functions. Whereas if it's in most places where it's the coders and then the billers, because again, it's two different mindsets. Not only that, the billers don't have to be certified. Now, yes, there are billing credentials out there, but you don't need them. If you look at the job listings, you'll see that those job listings say candidate must be a high school graduate and have experience in billing. And you can be like, have worked at a like Dollar General or something, and you still have experience working with money and things like that. So that's still a transferable skill to get you into billing. You're just doing medical stuff now. But that's where you have to okay, so the skill level is going to be different. So that's why a lot of times they have it separate as billers and coders, because the coders, they have to have the knowledge because they have to be certified. And sometimes people get hired without being certified because the facilities doesn't quite understand, or the doctor's office doesn't quite understand the importance of coders until later on, then they understand it. But with that, coders are just doing the coding. They don't have to worry about the billing. The billers are worrying about the billing side, and they're the ones negotiating with the insurance company, and they're the ones working with the patients to collect the co-pays and things like that. So if that's what you want to do, you can start off as a biller, or you can start off as a coder and then say, "Hey, I'm interested in learning about the billing as well." And you can make sure that they know your intentions. You can always do that. But if you're getting hired on as a biller coder, you're going to have a full plate, and that's a lot of work for one person. Okay, so just take it easy there. But that's what I would recommend. So let's see what else we got here. Patrice says, does it have coding involved? Giselle says, for all the entry-level jobs I need RHIT, RHIA, do you have any advice for entry-level jobs for someone like me who graduated health informatics and need an RHIT or coding certificate? What is it that you're wanting to do, Giselle? Like, is it that you want to do coding, or is it that you want to do something else? I mean, because health informatics is more on the data analytics side. So what are you really looking to do with that degree is what I want to know. before I answer your question. Patrice says, I'm a CIC. Lots of practice tests. Hi, Alexandria. Thank you. Yes, it did. Okay. Alexandria says, I got my first job since getting my CPCA is dental billing. Never thought about dental billing, but it is interesting. She goes on to say, our billing department is totally separate from our coders. Our coders work from home. Anne Marie, is HCC coding as bad as risk adjustment for? HCC and risk adjustment are the same thing. Alexandria says, I just took this dental billing job to gain experience in an office and to learn the other side of it. Anne Marie says, I work as an HCC. I work as a coder in HCC audits and risk adjustment. I'm ready to move on and move up. How long is too long to stay in this type of coding? 6 months. You should be out of there. 6 to 8 months. Some of my coworkers have been there for 4 years and feel stuck. Well, they are technically stuck because if you've been working in HCC or risk adjustment for 4 years, you have, I guarantee you, a lot of them have forgotten how to do procedural coding. And if you look at the job listings, and I know, and I say this because I saw it, I literally saw it. I wish I still had a copy of the job listing, but I have seen it on other job listings as well. They say if your only experience has been HCC, they do not count that as experience, only because it is just diagnosis coding. Literally, it's just diagnosis coding. And for some of you, your ears perked up, I know. Oh, just diagnosis coding. I don't have to worry about E&M. I don't have to worry about procedures. Yes, but if that's the only thing you're doing, then you're going to get stuck there. And there's not a lot of growth. Now, I did have a lady write me crying and saying, you don't understand. I'm a senior risk adjustment coder now. I don't care, guys. Senior risk adjustment or not, all you do is just diagnosis coding. In order to maintain that well-roundedness that you need as a medical coder, so that way you can go wherever it is that you want to and have more opportunity, you need to be in a place where you're going to be exposed to procedure coding, evaluation and management coding, and of course the diagnosis coding. So that's why I say it's not bad. I mean, clearly we need HCC for something, right? Statistics. But don't stay stuck there. That was my only thing, was that I don't want new people who don't know about the industry to get stuck in a position that's not going to help propel them forward. My whole thing is getting you guys to be propelled forward. I don't want to see a bunch of people be stuck and feeling like, oh, I'm so bored. Because a lot of times when people get excited about the HCC and then all of a sudden they're in it for a few months and they're like, oh my God, Blue, I'm so bored. Because you're doing only diagnosis coding. And a lot of times people are not as up on their pathophysiology like they should be. But that's a whole another topic that I don't want to get into right now. But that's the thing, guys. You always want to make sure that you're in a place that's going to allow you to be able to do a bunch of different things, not just one thing. Okay? At least this is my advice anyway. Patrice says, maybe this company has a coding department. Iron Man, I'm getting the coding specialist in August. Well, awesome. P says, as a coder, do you ever conduct training of clinical personnel to improve their documentation? Yes, I do. Any tips on how to approach this training? I'll come right back to that. Alexandria says, I have been doing my job, dental billing specialist, since December, and I feel like I've learned all I can. I'm feeling ready to find a coding job. Well, that's awesome. Patrice says, just needed money, but coding is more important. Then keep applying, honey. Just keep applying. Iron Man says, I'm getting into the coding specialist program in August. Should I brush up on my medical terminology? Abso-freaking-lutely. Like Alexandria says, Iron Man, you definitely need to study anatomy and physiology and medical terminology. All right. And so back to P's question, where as a coder, do you ever conduct training of clinical personnel to improve documentation? Any tips on how to approach this training? It's my favorite thing to do, my most favorite thing to do, because of the simple fact that I like to teach. I enjoy teaching. I always ask for 1 hour 1 hour. Sometimes it's a little bit of a jockeying thing back and forth, but I usually get my way. You need an hour. You do. Because a lot of times people are going to be quiet in these meetings. Now, the first thing that I will say is this: you got to come prepared. You have to be prepared. When you are giving a class to providers, you have to make sure, first of all, that you're well dressed. Do not show up over there in no jeans and no t-shirt. No, I've seen coders do that, and then they wonder why providers won't take them seriously because of how you're dressed. Okay, you want to make sure that you are in your Sunday best or whatever best outfit that you have. You want to be as professional as you possibly can. And also, now there's a lot of people that will use like the projector and okay, well, we'll hook up to the internet and then we'll have the screen up and things like that. I don't believe in that. I like paper and only because I don't trust those projector things either, because something's always wrong with them and it's, you can't connect and all of a sudden now you got a problem. So I like to show up with stuff in hand. Okay. If you're going to be talking for 1 hour, do a slide deck with only 10 pages, okay? And that includes the cover and the end sheet. The end sheet should have your contact information on it as well. Your name, and identify what credential you have, your phone number to your office, and then your email address, however they can get a hold of you. Because sometimes providers will not ask you questions in front of their fellow doctors or PAs, but they will email you later. So make sure that you have that information available to them, right? So when you do that, you have these slides, right? Now on these slides, you don't want to make the slide too busy. You want to do like bullet points. If you have a situation where you need to do a lot of education and you're like, oh my gosh, Blue, no, there's so much they have to do. 10 pages, period. No more than 10. If you go in there and you try to show up with 20 or 30 pages or 50 pages like we have to go through when we're doing our coding stuff, you do that, they're going to fall asleep. You have to be able to maintain their attention. And that's very difficult because if you do not get their attention in the first 2 minutes, then they're done. Okay. So what I like to do on these sheets is make sure that I get to the point. No fluffy stuff. Some people put pictures and things like that, little cartoons and things to keep it interesting. I don't know. To me, I don't do that. I mean, but whatever. People are different. If you want to do a picture here or there, that's fine. But don't be like these people who goes crazy with all these pictures, because it's not the point of the class. The point of the class is to get to the information. So do your bullet points, right? Keep the writing very, very short and to the point, because you can always speak and expand on all of these things. You don't have to include every single thing. If you're putting a definition of something, for example, you don't have to say, well, the definition is this, this, and this, and this, and this. You can just put whatever word it is, put, just a couple of words to describe it, and then you can talk about the definition while you're up there, while you're speaking. But the trick is to keeping them all paying attention is that you tell them when you hand out this slide deck, right? This 10-page slide deck, no more than 12 pages, okay? No more than 12 pages. When you hand out the slide deck, you tell them, I already know what I've written. I already know what's in this slide deck. So I would like you all to take turns around the room reading. Now, I can call on somebody, or you can, go whatever order you want to yourselves. And they usually don't want to be called on, so they will, go one right after another. And that's fine with me. But what keeps them engaged is it's not just me talking. Because you ever notice sometimes when you go to like a speech, right? Somebody's giving a speech and all of a sudden you find yourself nodding off because they have the same kind of monotone voice. Now, my voice is not monotone. I know it is not. But if it is the same, sometimes, it can be melodic and it will put people to be like kind of like in a trance and, not be paying attention. So this way, if they have different voices that they hear, now their brain is tricked into paying attention because it's somebody else's speaking. It's not Blue speaking. Who's that speaking? Oh, it's somebody else. And so as you go around the room, you'll see them pay attention to this. So let them read one slide, they stop, and then you explain or you do whatever. And you tell them in the beginning, that if they have questions, that they can just ask them as you know, you're going through the slides. But when you're explaining anything, don't say, does anybody have any questions? Does anybody have any questions on every single slide? You've already told them in the beginning that if they have questions, they can ask at any time, you know? And so that way it's not annoying, because there's nothing more annoying than that. When you hear somebody say, does anybody have any questions? Does anybody have any questions? Because then you're soliciting questions from them and they don't want to speak. Keep in mind this also, like I said in the beginning, there's providers that don't want to ask questions because they don't want to look dumb in front of their counterparts. And I tell them, really? I mean, really? Y'all are all doctors and PAs. Y'all are not dumb. Well, nobody wants to not know the answer, Blue. And I'm like, well, I said, whatever. You know, I will be there and answer your questions. They go, ha, 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 you know, because I have to go over there to them. And I'm fine with that because that's part of my job, you know, to make sure that they understand. And I'm okay if I have to take a few extra steps to go and see them. But when they're in this class, just be expecting it for them to not ask questions. Now, sometimes they will ask questions, right? But you have to make sure that you have your books with you. So in case they ask you some off the wall question, you can immediately look it up. If you do not know the answer to their question, do not say, I don't know. Don't say that. Make sure you say, I'm going to take a note of that and I will get back to you on that. Let me do some research on that one. And that way they can learn to trust you. It's about immediate trust. And they will learn to trust you if you are upfront with them. And nobody likes flowery talk. Nobody likes, I'm sorry. Don't ever say you're sorry unless you've done something wrong. Okay? Make sure that you say, well, I'm sorry to bother y'all. No, don't ever say that. Hey guys, I got some information for you all. Just gonna take a couple of minutes. And that's it. Okay? So be as yourself, as much yourself as you possibly can. Try not to show that you're nervous. But if you are nervous, it's okay. You can say, hey, this is my first class, so I'm a little nervous, you know, and you may get people, you know, giggle, but, you know, they'll take sympathy on you because they were there too. And so don't worry about it. And then you go on and you explain whatever it is, because keep this in mind. You as the coder know what they don't know. They don't know the rules about coding. They don't know all of these things like we know. That's why we're there. That's why they have us. I had a provider the other day come to my door and he's like, hey, Blue, so I have a situation. So he had a patient who was coming in who had a surgery before, and he was still in the global period. How was he supposed to code this? So I asked him a few questions and I had to explain to him about modifier 55. I had to explain to him about the procedure. I had to explain to him about if it was an evaluation and management. And then he was like, looking at me with this glassed over look. I said, this is why you have me, sir. Because I understand these rules. He goes, thank goodness, Blue, because I'm just like, I said, just document. That's all I need you to do is just document. I'll worry about the rest. And then so he said, okay. He goes, but that's good to know. And I said, exactly. So, you know, but that's what you do when you're doing a class, okay? You make sure that you think in your mind that you're giving them information. And if they have questions, then, you know, be willing to answer and don't ever say you don't know. Okay. Now, I will also say this as an aside too. My most favorite thing to do when I do classes, you don't have to, okay? Please hear me when I say this. You don't have to. This is what I do. This is what Blue does, because Blue gets very creative. I have my bear trap. If you're brand new to the channel, a bear trap is a candy basket. Okay, this candy basket is rather famous. Okay, because I leave candy out in my office. I've got everything in there, but I use coupons, I use points, and all this other stuff. So I don't pay nothing out of pocket basically for this stuff, right? So it goes into this basket, and I leave this basket out. Now I say it was famous. It got famous because I started doing this. And my providers would come in and they would see this candy. And so they would go over there, hey, can I have a candy? Yeah, sure. And then they stand there, and then as they're, you know, eating their candy, hey, Blue, I have a question. Because they've relaxed. They've relaxed for a minute. And no one else is around to be like, oh, you don't know that, bro. They don't have that because we're in my office, right? And I say, yeah, and I'll stop and I'll be like, okay, what's up? Well, I had a situation where, I had this and this and this. Okay. And so we're able to talk about coding. Okay. So that leaves that door open. So then they leave with a little bit more knowledge, and they leave with a little bit more trust for the medical coder, who is not here chasing them with a red pen, but she just answered my question. And now I feel more confident as a doctor because, now I know what to code. Okay. So whenever I do a class, I always bring this basket in and I will leave it there so that way they can be munching too while we're, doing this class. But I say the basket got famous because my doctors were at another facility in our hospital group out of town, right? And I don't know how it got brought up, but my candy basket got brought up. So they were talking and they said, oh yeah, our coder does this and our coder does that. And, she has this candy basket and she leaves it out and there's water and everything. And they're like, well, how come our coders don't do that? And they go, well, and then the administrator that knows me, and he heard the whole thing going on, and he's like, well, the reason that she does is sort of genius in a way, and I never really put any words to it. It's just me. That's just how I am. I'm Hispanic. And that's what we do. We feed people, So, but he says the whole thing behind it is that what animal is the highest in the jungle, right? The bear, right? How do you attract bears? You leave food out, right? So that you can take pictures of them or whatever. I say it's take pictures, but to take pictures of them, you leave food out so they can be out there, right? And then that's how you attract them in. It's the same thing as what she does, is that she's attracting the bears, right? From her clinic into her office, and they stand there and they talk to her and they build that relationship and they build that trust, and they know they can go to her with any questions that they have. And so they're like, wow. They go, well, how can we get our coder to do that? They go, you have to talk to them. But she does that all on her own. And it's just going the extra step, but that's what I do to communicate with my providers. And now some people will disagree with me, and some people, I don't want to do that. Well, if you don't want to do it, you don't want to do it. Don't do it, but I do it. And again, I use points and I use coupons and everything else so that I don't have to come out of pocket for it, again. Using a little bit of creativity, but it works. And I have the best and most highest providers who perform very well in the hospital. So, doing something right. All right. Let's see. What did I miss? Can we ask more questions online by email? If you're asking me, yes, my email address is in the description box. Alexandria says, I bet Bleu brings candy and M&Ms, etc. for her providers to perk up and pay attention. LOL. Yes, I do. Do you have any videos on beginner coding? Like scenarios, Patrice? Is that what you're asking? Iron Man, I have not taken physiology in a while. Do you think I will be okay? I'm nervous about that. LOL. Pick up a book. That's all you have to do to get back into it. It's like riding a bike. If you are motivated, Iron Man, you'll do great. I needed that. Okay. I love talking about this. You got this. Trust the process. And Blue, yes. P says, when coding for a physician group, do you recognize times when something changes in their treatment strategies based on insurance reimbursement changes? Do they include coders in clinical meetings? Sometimes they do and sometimes they don't. And sometimes you have to be the one to include yourself, because otherwise they'll forget about you, even though you're there in the clinic. Oh, I forgot. Really? But it really depends on the leadership as well. So you have to really kind of get yourself involved. If they're having like a huddle, some people call it a huddle. And if they're having a huddle, then you want to make sure that hey, I'm right here, I have something to say, or whatever. But you always want to kind of show your face or have that engagement. If you're not in the facility or you're not at the doctor's office, you can always do a coding tip of the week, which is what I do. I haven't done a coding tip in a couple of weeks, but there's been a lot going on, guys. We have this whole thing with the electronic medical record, and it's just, it's enough to drive you nuts, right? But I haven't done it in a couple of weeks, but normally what I do is if I start seeing a trend, things start changing, if they're forgetting to add something to their note or whatever, I'll make a note of it, and then I'll send out one tip in the coding tip. Because if you try to put too much information, it's going to fall on deaf ears. And going back to, if I can circle back for a second, the slide deck for your class, pick 3 topics to talk about. Don't do no more than 3 topics, because if you have a bunch of things going wrong with these providers and all of a sudden you come in with a griping list, which is a PG way of putting it. If you come in there with a griping list and you all of a sudden you say, oh, all of these things are wrong and y'all are doing bad, no, they're going to tune you out. 3 topics, your most important 3 topics. Make a list of all the things that they need to improve on, and then start picking it off little by little. But do 3 topics at a time when you're in person with them. That gives every topic around 20 minutes. And it's okay to embellish a little bit on like some of the other topics that you know you need to cover, or if if they go through that pretty fast. Don't let them get out of there too fast, guys. Okay, sometimes they may try to pull that with you, but you can always continue on the conversation. I'm a Texan, so it may be a little bit easier because that's naturally what we do, is we talk, right? We like to talk, and that's what we do. But sometimes, the conversation will continue because they want it to continue. All right. And sometimes you have to kind of coach it along, right? And so if you can throw in some kind of interesting factoid, to keep them interested, or you can call out one of the providers for something really great that they did. Hey, so and so, they really did document very well in this type of situation. You can always say that because they like that too, because now you're giving out compliments. And I like compliments, because you'll see some of these doctors, they will be just like they were in medical school, where they like to get all A's so they can get the pat on the head from the professor. It's the same way with the coder. And believe it or not, they will start to care about what you think about them and their work if you build that trust with them, because they're always looking to see, like, oh, who's she going to give a compliment to? Well, if you do the stuff right, I don't have no problem complimenting you, but I'm not going to compliment people just for willy-nilly, just for the sake of doing it. If I give you a compliment, it's because it means something. So, they have to earn it. So, but that's what you do. That's just my advice anyway. Patrice says, where did you get your desk? I love that. Looks like it holds all your books. I got it on Amazon. I actually have the link for Amazon, the L-shaped desk that I have. I think it's by Cole's Home. But when I update the description box, it'll be there. Thank you, though. Green says, do you recommend study groups? What do you think about online coding classes versus in person? Okay. So I talked about this the other day, about setting up your own study group. Now, I said in the video, sometimes study groups are really great, but it depends on if everybody's in the same boat. If you have everybody with the same type of energy, as far as like everybody there wants to learn, everybody there is trying to learn, nobody is there to complain, because a lot of times these study groups turn into griping sessions. Again, a way of PG, putting a PG. They want to get together and complain and talk about the teacher, and so didn't teach me this, and so. No, there's no time for that. If y'all get together for an hour or 90 minutes, you want to make sure that you are there and you're present and everybody is on board. Okay. I said in the other video that if you want to do a study group, make it small, for no more than 5 people. Okay. And that includes yourself. So that way the group can be small. Y'all all make a list of all the things that you know and the things that you don't know. And then you can compare lists. Okay, well, you may understand evaluation and management, but I don't understand it. So then you have a chance to tell everybody in the group about it. Because the best way to learn something and to be able to retain it, especially as adults, is to be able to teach it back. So when you do that, then it's just like, okay, everybody can learn from each other. But if you get stuck and everybody doesn't know the same thing, the same subject, everybody's kind of stuck on that one same subject, then you can reach out and find a mentor who can help y'all for free, or you can try to hire a tutor. Now, people have asked me if I do like the group tutoring like that. I have not done like a group tutoring like that. I do have on my Patreon channel is a study hall. We meet once per month, and it's on a Saturday. The next one coming up is on the 20th, and it's going to be at 4 p.m. Pacific Standard Time, 6 p.m. Central Standard Time, and 7 p.m. Eastern Standard Time. And during this hour, sometimes it's 90 minutes, it just depends, people will come to me with their questions, and then other people get to learn from their questions as well. So, everybody learns. It's a very good group, and sometimes the group is really small, and sometimes, there's quite a few people there. I mean, it really all depends. But the whole thing about study groups is that everybody needs to participate. And I've heard from other people who've run study groups before is that some people will show up and not ask questions and not want to participate, but they just kind of want to sit back and listen. And that's not fair, because then you're not contributing anything to the group. When you're doing a study group, that's what it is. It is a study group. You are all working together to be able to figure this stuff out. And sometimes people will have a bunch of chaos in the back. If you're all meeting on Zoom or Google Meet or something like that, and one person will have chaos going on in the back, that person probably is not in a place to be in your study group at that time. Okay. It's not a time for chaos and things like that. No one is going to miss out on a bunch of things just being gone for 1 hour. Okay. Nobody. And if they are, it's because either they don't have anybody to watch their kids, or it's just another excuse. So yeah, sometimes people use excuses. Y'all know, but sometimes people just don't know, but yeah, so be careful about who is in your group. If somebody is complaining, that's not the person that you want in your group, because it's about business. Okay. It's about the business of studying. And so that way you all can learn from each other, because those are the most successful study groups, is when everybody's on the same page, everybody wants to learn, and everybody has something to contribute. So hopefully that answers your question. And as far as online versus in person, it's always better in person. However, sometimes teachers just don't teach very well. And sometimes you can find really good teachers online. It really all depends. Sometimes it's just a luck of the draw. But you have to remember sometimes that some, please hear me when I say some, okay? Some teachers have not taught in years, and some have not been coders since before in 2014, okay? 2014 was the last full year that we were working with ICD 9. We went to ICD 10 in October of 2015. So when you are going to a school, you want to ask them, hey, when was the last time the teacher was coding in the real world? And if it was way before then, in 2014 and higher, or lower rather, then you want to make sure that maybe I'll pick someplace else, because I want somebody who has recent coding experience. And as we all know, with E&M changed earlier, a couple years back now, right? There was a lot of changes to E&M. And so, it's important that somebody who has been around in the industry and has seen those changes. It's not going to be somebody that, I haven't been coding in years and I don't really know, other than what the book is teaching. Because the book and the real world are two different things. And you're going to learn that real fast when you're out there in the real world. So, but that's just what I would say. Vet the teacher, talk to the teacher. And if the teacher gives you attitude, that's exactly what they're going to give you when you're in the school. So do you want to spend whatever, $10,000 or $20,000, God forbid, $30,000 going to that school? Heck no, you find yourself another school. And if they tell you, well, we have a deal right now going on with the school, and, it's a special, and, you have only till Friday to sign up, get out of there. Because you know why? There's a lot of schools and there's a lot of deals all the time. It's not just, it's going to go away forever. And remember this, you get what you pay for. Okay? You get what you pay for. So if you go for a really cheap program, keep in mind, and really cheap, meaning that the program is like $800 or $1,200, $1,500. Those are really cheap programs, really cheap. Now, while they may work out for some people, just know this, you're doing a lot of that stuff on your own, and you are going to be working with books that may not be the best books either. Okay. I recommend the ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers by the American Hospital Association. Nellie Leon Chizen is the one who wrote that book. And I recommend the CPC study guide. Now, even if you're taking an AHEMA exam, I still recommend the CPC study guide because we are all tested on the same CPT manual. And I will give it to AAPC. They got it right. So did AHA. They got it right too, with that ICD-10-CM and ICD-10-PCS coding handbook with the answers. And again, all those links will be in the description box after this video because the description box is not updated. But if you look on any of my other videos, the description box is filled with all the information in it. So, all right, let's see. What do we got here? Patrice. Sal. Is it Sal? Sal. Hello, just got into medical coding and enrolled in AAPC CPC exam prep course. Wish me luck. Good luck. Patrice says, how often can I catch you? Love your work. I do shows here on my YouTube channel Monday through Thursday night. This would have normally been a pre-filmed show, but I had a lot going on. But it was a very good night. Let's just say it's a very good night. And so I had to come on live because I didn't have time to film before. But yes, Monday through Thursday is when I do my shows at 7:30 p.m. Central Standard Time, 5:30 p.m. if you are on the Pacific Coast, and 8:30 p.m. if you are on the East Coast. And I do that. But of course, I have my 1,000+ videos that you can look at any time. But I normally do lives like this once a month. And I was technically supposed to do it on the 26th. Yes, on the 26th. But, yeah. It's okay. I will be on here live on the 26th. So don't worry. I'm not going to cheat y'all out of when I normally do a live, which the live is once a month on Friday, and the next one's going to be on the 26th. So I will be live next week. But yes, on Friday. So that's when I have my shows. All right. Patrice says, oh, what is the 5 things that you, what? Oh, what is the 5 things that would end your coding career? Is it okay to keep the, like if you messed up, what are the 5 things you could do if you really messed up your coding career? Well, I mean, obviously not coding correctly will end your career really, really fast. If you if you look at information you're not supposed to, that'll end your career really fast. If you are unethical, that will end your career really fast, you know. Hopefully that answers your question. Is it okay to keep the practice test to stay fresh? Absolutely. Is there any reason I should keep all of my old code books? You know, in your old code books, there is information that never expires, like the anatomy plates. You know, you can go through whatever book you have and see if there's something that you would like to keep. Of course, you can do that, or if you would prefer, you can always donate your books to the library. You know, you can always do that if you don't want to take apart your book, but you can, you know. Let's see. P says, if I wanted to job shadow a coder to experience a day in the life, what could I do to make this as helpful to them as it would be to me? I think that you would be hard pressed to find that. Why? Because you doing something like that, like a day in the life of a medical coder and watching them shadowing them, then you would be looking at their computer screen with patient private information, and that's a no-no, because then that would be violating HIPAA. So that's not something that's really that you're able to do, because you wouldn't even be able to go back there, you know, into those areas. Where we work at as coders, if you're working in a facility, is a secure area. You know, me personally, I'm embedded in the clinic and I have my own office with a door with a lock. That is how you are secure. I mean, all of my information is secure. If I leave my computer, I have to pull my card and it'll lock my computer screen. You know, that's how, you know, serious it is. But if you are with a program and you're, you know, like with a college and stuff like that, then that's something different. But even still, they still protect the patient information. They don't just share it all out there willy-nilly, you know, to whoever comes through the clinic. You know, that's just not what they do. So that's why I say it's you're a little bit hard pressed to find that. And people have asked me before too, oh, well, can't you just share your screen like when but blur it out? No, you will never catch me showing y'all what I do on the computer screen, because even still, if you blur it out, there's always going to be some computer geek out there that can be able to unblur that. And guess what? You've just committed a HIPAA violation. So no, I will never do that. Y'all will never catch me doing that, because I would never want to risk the patient information and, of course, my credentials. Never, ever. I'm just saying. Patrice says mine was $2,700 for continuing education. That's about right. I mean, the average cost is about $5,000, so $2,700 is still a good deal, you know. Green says, what about the community college coding program for AAPC? Again, if they have like an instructor there, like somebody was saying that about their school, their college, they do the AAPC program, but the instructor was really bad that they had. And so, you know, it really all depends. Again, you have to, oh, I want to sneeze. You have to vet the teacher. So if you're going to sign up at the college, you ask them, I want to speak to the professor. So that way you can get a gauge of that professor and you can know, because it's your name that's going on that dotted line. And it's you that is going to have to either pay for it with time or with money to go to that school. Okay. And nobody likes student loans. Okay. But there's people who sign up for student loans all the time thinking this is what they need to do, rather than doing their research and making sure before they give out, they fork out all that money. I would not want to fork out $2,700 or $7,000 on something that I wasn't absolutely sure that I was going to get the most out of. I'm just saying. Let's see. I'm making a special book for coding. Let's see. Green says, the classes aren't expensive. It's the textbooks at my community college that are high. Yeah, unfortunately. Patrice says, I guess I'm just nervous, but I know I got this now that I took this job. Hope entry level coding pays. Well, I mean, depends on where you are. And like I said, we don't talk about money and specifics on my channel. The only reason that I'm like this and I'm really, really hard about this is only because there are so many people being sold medical coding for a really high salary. And that's what they want. They want the really high salary. But what they don't tell you, these people that are selling these programs that are saying, oh yeah, you will make all these really high salaries. They're not telling you that that's up to. Whenever you see up to in a salary, right? That's like the max end, right? And that's usually for people who have experience. And then you have a bunch of new people coming in demanding that high salary because they think that that's what they're going to get, right? Instead of going to the Department of Labor or the Bureau of Statistics to be able to research in their area how much a medical coder makes. Because everybody makes a different amount to start, depending on where you are. Florida is going to make a lot different from Michigan. Texas is going to make a lot different from New York. New York is going to make a lot different from California because of the local area, the economy and everything in that area. So there's going to be adjustments depending on where you live. So that's why I never give out an actual number. And I've caught a lot of heat for that over the years since I started my channel in 2018. And that's okay. I'm fine with it. I'm fine with upsetting a few people. That's okay with me because of the simple fact that, again, if you do your research, you'll be able to find out, you know, what beginner coders make in your area. And then it goes up from there. But where you start, I will say this though, where you start salary-wise is not where you will stay. And that's where a lot of people get hung up. They want that high salary first, right out of the gate. For a lot of you, no, you need time to work up to that. Think about it, because it's a business, right? And if people were in the business of just giving out all this money, businesses would go out of business, right? That's why you start off at a starting salary and then you move up, right? Now, when I started off at a good rate. And then when I moved and went to another facility, I got even more money. And then when I got here to my forever home, I made even more money. And I had those jumps in that first year. I wasn't even a coder for a year, but I was a long way from where I started to where I ended up. And I don't even want to talk about what I'm at now. You know what I'm saying? And it's different. It's different everywhere. So, but that's what I say is don't get too fixated on where you start, because that's not going to be where you finish. That's just where you're starting. And that's what I want you guys to know, is that wherever you start, it's not going to be where you finish. It's not going to be staying the same all the time. And if you get in a place and you're not making as much as you would like to make, and that you think that you should be making, because according to the Department of Labor or the Bureau of Statistics, when you looked it up, this place is paying a little bit low, you can still apply. Take what you learned at that place and move on to the next place, guys. It's business. It's not personal when you move on. You know, a lot of people, they don't want to move on because, well, you know, I got this job and they took a chance on me. If something were to happen to you, they would have your position open for business the next day. That's how serious it is, guys, because they need people in there. So it's not personal. That's the way you have to look at it too, that it's not personal when you leave them, because where you start is not going to be where you stay a lot of times. Rarely is it that when a person starts somewhere that's going to be their forever home. If that was the case, I'd still be at the Cancer Therapy Research Center, but I'm not. I'm a long way from there. But that's where I got my start. And that's where I learned a lot. You know, it's that was cancer coding. That's your first shot out of the gate, is you're doing neoplasms. And that was pretty serious stuff. But I learned a lot, you know. And so moving on to the next place and the next place, I learned even more, you know. And that's what, learning what I learned in my second facility is what got me to my forever home. So that's the thing that you got to think about. Where you start is not where you will stay. All right. It's just the beginning. It's just the beginning. And you have to learn to work up. You will work up. And then the more knowledge that you have, the more that you are willing to take the stuff that nobody wants. And that was another reason why I was able to get in where I am now, is because I was doing the professional fee coding, or pro fee. You'll see that out there in the job listings, pro fee. It's basically that the patient is staying in the hospital, but an outpatient provider is coming up to the floor and they're seeing them and they're doing their service for them. And so they have to get paid for their professional fee. Well, that's confusing for a lot of people from where I came from, right? They were like, Bleu, there's a lot of people that quit this position. Are you planning on staying? I'm like, look, I just moved hours away from home. This is a no-fail situation. I'm going to learn. So wherever you need me, and that was my attitude, is wherever you need me. I was not there to say, I want an entry-level position. I want something easy to start with. No, you got to go feet first, because of the simple fact that when you pass that certification exam, it's saying that you have the competency to be out there and to code anywhere. And don't be afraid of anything, guys. Really don't. Really and truly don't be afraid. There's so many resources out there that can help folks to learn whatever it is that they're learning. When I was doing physical therapy coding, I was like, what the heck is this? You know, so I had to do like a lot of, you know, looking up of stuff, you know, back then. And it was just like, okay, now I got it. And then I was able to get it. So you can look at all those resources out there. Google is your friend, guys. Google is your friend. And the fact that you didn't learn it in school is stuff that you can learn online. You know, learn through watching YouTube videos for like medical terminology and anatomy. And you can learn all that through there. CMS is another great resource, cms.gov. It's got a lot of really good and helpful resources for coders. I'm just saying. Do you do one-on-one help? Yes, I do. I do tutoring. Normally my rate is in the description box below, but when I update this, it'll be there. Yes, I do tutoring, and I do tutoring after 6 p.m. Central Standard Time, which is 4 p.m. if you're on the Pacific Coast, 7 p.m. if you're on the East Coast, Monday through Friday. And then on the weekends, I am available for tutoring after 11 a.m. on the Pacific Coast, 1 p.m. on Central Standard Time, and 2 p.m. Eastern Standard Time. So if you're interested in booking with me, contact me. Again, my contact and my rate will be below when I do update this video. Green says, would you say it's a lucrative career if you want to work remotely, possibly out of state? I'm in a state that doesn't pay much, unfortunately. So when you are brand new, that's something that you got to think about. Yes, there is opportunity for you to work at a company that is out of state, but sometimes these companies will either pay you their rate for their state, which is sometimes more, right? Or they will pay you based on where you are. So I've heard of that too, you know. But most of the time I hear it's for the companies wherever they're at, you know, their headquarters. That's what they pay. So I mean, it's really on you to be very proactive and to be looking. But I always say, new coders should not start off at home. That's just my advice. The reason that I say this is because bulk coding and real world coding are two different things. And for some, when you start, it depends. Some people are very supportive of new medical coders. I'm always supportive. When there's a brand new coder, I can't wait. I can't wait to mold this new person's mind because they're brand new. They have no bad habits. But there's going to be some people who will say, I'm not going to train you because no one trained me. Sink or swim. And they will be like that with you. And when you work at home by yourself, that is the worst feeling to have, is when you're trying to message somebody and by messenger and trying to ask them a question when sometimes you're not going to even be able to figure out how to word the question. I know because I went through that when I was at my second position. Jessica, my boss, who is now my friend, I consider her my friend. I would tell her, Jessica, I don't know how to ask this question. She goes, okay, Blue, tell me what you know. And so I would tell her, and then she would be able to, oh, okay, I see what you're doing. And so then she would explain and break it down to me and stuff like that. So, oh, okay, you know, and that's how I learned from her, you know. But again, I'm in person being able to do this. Doing this on a camera, you know, over the phone, through Messenger, it may be a little bit tricky. So that's the thing, you know. I always recommend at least going to a place where you have to be with somebody, even just for a couple of months, you know, or even just for a few weeks, just to get that one-on-one before you go feet first in the frying pan. You know, what is it? Yeah, feet first in the frying pan. Uh, before you do that, it's just to set you up for success. You know, it's not forever. It's just so that you can meet somebody else and you can be there face to face and ask them questions. That's just what I'm saying. Because again, I want y'all to be set up for success. And again, a lot of these schools are selling the field based on, oh, you can work remotely. And do you know you can be at home raising your kids and doing all these things? And no, you can't, guys. Because even still, you have to treat it like you're going to the office. You have to be focused. And if you have to start and stop because you want to go put laundry in or you want to go run an errand real quick, that's just not the way that it is. There's some people who do that, and maybe their manager will let them get away with it for a few times, but you do that one time too many, and then it looks like you're taking advantage of your employer. And they don't like that. And they can be quick to let you go too. Just saying. All right, let's see. Patrice says, where do I get to the CPC training since I paid for the CIC school? It's too much, but I want at least 2 certifications. Where do I go to get the CPC training since I already paid for the CIC school? Are you doing it online, Patrice, or are you doing it at a school? Thank you for all your advice. It really means a lot. To new coders, I've been in billing and coding for 18 years. I should know something. Can you let us know when you're coming on again? My nickname is Pat. It's short. Okay, Pat. Do they say once you learn, you never forget? Yes. Alexandria says, I wish I had people like you at my job, Blue. But basically, it's because it's basically frantic and everybody is wrapped up in their own issues. Yeah. Yep. It's so sad. I am a flower. Thank you for all the info, Blue. You are the best. I feel like I'm getting candid advice from you and you're not just trying to sell us something. That's right. Because that's the thing. I love what I do, guys. I love the field and I love being a medical coder. I feel like I have not been working since 2014. And so I like to share that feeling. I like to see excited coders. I like to see coders that are just as excited as me. And so when I have a chance to talk to new people and to be myself and to be as giggly as I want to be, even though it annoys some people, or clap my hands. Don't clap your hands. I'm gonna clap my hands all I want to because I like to, and I like clapping. Clapping is like happy, you know. When I get to be that and I get to be myself and I see the channel grow, it's a wonderful thing. It makes me so happy to be able to do this and to share this with other people. You know, that's the awesome part about it. I say that my channel is dedicated to my mother because my mother was there to push me to when I was becoming a medical coder in medical coding school. And her guidance, her support was everything. She is the reason that I am a medical coder today and that I'm able to love what I do. And if you love what you do, you never work a day in your life. And again, I have not worked since 2014 because in 2014 is when I got it. When I finally freaking understood, I was like, okay, now I get it, you know, because I got my certification in 2008, you know, so it was a time coming, you know, for me to understand what it actually was. And now here I am 15 years in. Been a coder for 15 years. That's a big part of my life. And this means that this is the thing I've done the most and the longest in my life. So, you know. Pat says, I stay at home to take care of my elderly parents. Bless you for doing that. That's awesome. Alexandria says, good night, everyone. I have an early morning. My 4 children at 6 a.m. and then work. Good night. Pat says, yes, come live with me. I have no sisters, just 2 brothers. It's your channel. Do what you want. Clap those hands. Yes, love you. We can tell you genuinely love what you do. It makes me feel like I'm getting advice from a friend. Well, that's awesome. I'm so glad. Pat says, I love coding for years. I worked in a hospital and never got a chance. I never got the courage to pay for better things. But it's not too late, right? That's the thing. It's not too late. It's never too late, you know. People get into this field all the time later, and they change paths all the time later, you know. And sometimes it just takes you to grow, and whenever you're ready is when you'll do whatever it is that you want to do. Because people can tell you what the proper thing to do is, and people can give you their advice, but, you know, it's all when you're ready, and it's all going to be on your time, and no one can push you until you're ready, you know, just saying. But I will say this, you know, life goes quick. So you better love what you do. You better enjoy something, you know, you better enjoy what you do and have a reason to wake up every single day. I do. I have a reason to wake up every single day. I love what I do. I love my career. I love my channel, both my channels, YouTube and Patreon, you know, and there's a lot of stuff that I'm doing in the back that I don't bring here, but I have it on Patreon. But, you know, it brings me joy. I feel fulfilled in my life because of it, you know, and not everybody can say that. Because sometimes people will say, well, I do my 9 to 5 and I'll be happy when I get to my retirement. And then when they get to their retirement, they're so bored because they don't know what to do with themselves because their whole life has been to work. And what about enjoyment? What about enjoying what you do? You know? Food for thought, the same. Pat says, I'm 59 now. Go figure. There you go. Can you please keep me on your list? Let's see. Green says, I'm leaving the education field, going into coding, and a lot of people don't understand why. But you know what? You're bringing transferable skills, being a teacher, going into coding. You know why? Because guess what you have to do as a coder is to teach providers. So you already know that. You already know how to teach. You already know how to do that being in the education field. It doesn't matter if you've been a teacher or you were a coach or anything like that. You still know how to work with people, and that's very important to bring, into this field. And I've seen teachers go into this. Of course, I've seen nurses go into this. Sometimes at the beginning of their career and sometimes at the end of their career when they're retired and they want to still do something with all of their knowledge and with everything the nurses have to know. Oh yeah, I would want to do something with that knowledge too. So, I hear 1K. That's kind of low, isn't it? Isn't that, Pat? That's kind of low, isn't it? But if you're talking six figures, there's people out there that say that all the time. And that's how they get people in. And but you know why they do that? Because if you actually told people how hard medical coding is to get to understand how competitive it is once you get out of school, that we have to know what doctors know while never having gone to medical school. If you actually told them that, they would be running for the hills. You know how many emails I get from people who say, well, Blue, I didn't know it was all this reading. What do you think medical coding is? It's reading. It's understanding and comprehending medical documentation. That's why I say your reading skills and your writing skills have to be impeccable, because if they're not, you're going to struggle. Because when you have to do queries and stuff like that, sometimes you're using a template and sometimes you're not. And if you're not using a template and you have to come up with all these words, you got to word it the correct way, You have to do things right. And so with that being said, with all those things, guys, it's so much that we have to do and learn. And medical terminology is enough to run off people. Learning about anatomy is another thing. People will tell me, Blue, I hate anatomy. Why can't I just learn coding? Because if you don't know your anatomy, you're not going to know how to code properly. And that there's some things that mean the same thing, and then they use different words and things like that when they're, looking up in the book, and in the book it's completely different sometimes. Sometimes you're not even thinking about like what words to look up in the index because you're so busy looking for other words when it's under something so simple, right? So that's the thing. If you told people that, they would run for the hills. That's why they got to make it all shiny and pretty. And they got to tell you all the fun and nice things about it. It is a good paying field. And for people who don't have degrees, it is a good paying field. We make more money than people who have degrees. But look at all the work that goes into it. Look at everything that you have to know. All of your medical terminology, all of your anatomy, all of these things that you have to know in order to be a medical coder. Everything, the time, the investment of time, the updates that we have to go through every single year. And then when it was the pandemic and they had to add a code, let's talk about that craziness for a second. In the middle of the year, unprecedented times, in the middle of the year, they had to add a code. And then now they have to add all this guidance about when to apply that code. And this code only is applying during these dates. So we have to be ready and prepared to be able to handle all these changes, because it is a lot. And you're learning all the time. I'm still learning. And I'm a 15-year veteran. Still learning. But again, you have to want it. You have to like it. And you have to want to put your investment of yourself and your time into it. Not 24/7. Not 24/7. Somebody says, oh, Blue, do you mean 24/7? No, not 24/7. But you do have to be able to do your research, and you have to be able to look for all these other things to help you to understand better. And even if it does mean watching videos on YouTube from channels like Crash Course, and I don't want anybody complaining because I love that channel. I love Crash Course, and Crash Course was what got me through medical terminology and anatomy, and I love their videos. And they're funny, they're short, they're animated, and by short I mean 10 minutes. I know that's a little too long for some people, But I don't do TikTok here. I don't do TikTok. You know, you won't catch me doing any of those things because, again, that stuff contributes to the short attention span. And adults are having more of a shortened attention span now. And I don't want to get off on another whole soapbox on that. But the attention span is getting shorter and shorter for adults. And that's not a good thing. Hold on to your attention span and don't get sucked into, you know, TikTok with those little short reels. You know, no, don't do that. Make sure that you take the time to learn something. Show patience when you are learning. And don't just try to like cut the shortcuts and do all that stuff because it's not worth it. I'm just saying. People get scared when they see what that's all about. What do you think about books for beginners? You recommend the ones that I just said. Lizzie says, I will not lie. I got scared with all the information I was given early in my coding course. Glad I found Bleu, made me stick with it. That's right. I'm so glad. I'm so glad. Flower says, Crash Course is so informative as the medical terminology book you recommended. Yes. Yes. Very good. I don't know. No, I've never used a website Certify. Never. To find codes. Because even if you are a student, your main focus should be in the book. I know you're not a student right now, but for everybody else who's looking at, you know, trying to look at encoders and things like that, if you're a student right now, don't be messing around with no encoders because you need to focus on learning in the book. And that book can be learned without tabs, without highlights, without any of those things, because tabs will get in your way, and you should learn without tabs. And before you panic, it is possible, because all it's going to do is make you a stronger coder if you don't have the tabs, because they're not going to get in your way, and it's going to force you to look through the book. And the more you look through the book, the more you get focused on the book, the better off you'll be when you get into that exam room, because you're not going to be sitting here fumbling with that book thinking, oh my gosh, I don't know where to find this stuff, because you're going to know exactly where to go because you've been practicing. I'm just saying. I missed the book title. Okay, let's see. Here we go. The CPC Study Guide. You don't have to get the 2019 version. Please don't get that one because they overpriced it already. You used to be able to, and don't judge my nails, guys, because that happened today. All right, I broke my nail. So do not judge me, okay? But this book is really awesome. When I started suggesting the 2019 version, this book, I could find it for $10. I cannot find it for less than $85 now, anywhere. Okay, so you can get the 2020 version, the 2021, 2022. If you get the most recent and up-to-date one, it's going to have all the recent codes, but it's going to have exactly the same questions as the years before. And the years before books, while there may be a couple of codes updated here and there, it's not the same, right? It's going to be the same anyway, is what I meant to say. It's going to be the same. So don't even worry about it, okay? Save yourself that money. You don't have to get the brand new book. Get you a couple years older so that way you can save a few bucks. Okay, I'm just saying. But this is the one you need to use to study the CPT book. And yes, even for my AHIMA people who are taking the CCS, the CCA, or the CCSP, you need to study for that outpatient side. This is your book, okay? It doesn't look intimidating, but trust me, it does the job. So that one. And then there's this one. This is the one. Even if you are not taking a test that has PCS on it, all right? If you're taking just the CCSP or even the CPC, you can skip over the PCS portion and just concentrate on the CM, okay? So the diagnosis coding and the inpatient procedure coding is covered in this book, and it's got the answers. Nellie Leon Chisen is the one who wrote the book. It's from the American Hospital Association. So this book, again, this book is so high now. You used to be able to get it for $39, and now I can't find it for like less than $100 and something. So like $124 is what the last one I could find it. So if you can find the one that's, maybe 2021 or 2022, that's fine. But make sure you get the one with the answers. There is a version without the answers. Don't get that one, because how are you going to know if you got it right or not? So make sure that you get the one that is with the answers. Okay. But this one, I'm telling you, it will help you. It's a fantastic book. And those are the two books that you need to learn with. Those are the two. And the Amazon affiliate link, you don't have to click on them. Okay. People were crying about that too. Oh, you're only doing this to make money. No, y'all asked me for the link. That's why I put it there. If you don't want to click on the link, go click on the link. The title is there, So I tell y'all guys, I'm just saying. But yeah, so you can do, see, I knew I had a hair on my hand. All right. Let's see. Pat says, I was so proud when I got my certificate from school. Jeannie says, I have to list resources for my class discussion, CPC exam review course, and was writing about you, looked up your channel again and saw your live. Haha. Flower says, I found the 2020 version with answers for $45 a few weeks ago. Okay, cool. That's the 2020 version. And if you look up the 2019 version, you'll see it's like $100 and something. Isn't that ridiculous? But it's because, that's the one that I've been recommending, and even when I look on my Amazon account, I see that people have been ordering it. So while I'm really glad, it's probably why the price went up, because they saw that book was being ordered, but if you can get a newer version, get a newer version. Okay. So, but those are the two books that you can learn medical coding from, and they've got the answers and the rationale. Now, there's a couple of questions in the CPC study guide that I don't really agree with, but overall, it is a great book. I'm not going to discount it for a couple of ones that I personally disagree on. The rest of it is a fantastic book. It goes over medical terminology. It goes over anatomy. It gives you everything. So that's why I say, even if you're taking an AHIMA exam or CPC exam, obviously, that is a fantastic book for it. I'm just saying. Yep, you are doing too good of a job advertising it. Yeah, I think that's what happened too, so. But, people want to know. And those are the two that I recommend. And like I said, I would tell y'all the things that I recommend, because there's a lot of books out there that are not good and that a lot of the schools are using. And so it's very easy to get frustrated with those books because the way they're written. I'm just saying. So with that said, it is 9 o'clock, y'all. I'm going to go ahead and wrap this one up because I talked way too long. And yeah, we're already at almost 90 minutes. But that's okay. That's okay. You know why? Because there's another YouTuber I watch. His name is Rick. He has his channel, Think Like a Horse. Now, Rick from Think Like a Horse, okay, I'm just saying, the guy's he's a little rough sometimes, but he is freaking funny. And not only that, he has horses and stuff like that. He used to be in the military, and then, he trained dogs as well, and so now he has his horses and things. And so and he used to be a cop too. So the way he sees things is very blunt and in your face, and okay, and so sometimes I can sit there listening to Rick and I'll be sitting there cracking up, but he does his live shows. He goes on for hours, and then he always says, Rick, when he's like saying that the people are complaining about him or whatever, but he'll sit there drinking coffee and I'll be sitting there listening to him cracking up, and I'll be doing my thing, so. And that's why I don't feel so bad anymore when I go on for really long times, because I used to have people say, Blue, your shows are too long. Then don't watch. What do you want me to do, But, anyway. So, yeah, Bucks. That's the one. Yeah. Can you get those books on Amazon? Yes, you can. If you're calling him blunt, I'm scared. Yes. And I'm like, people say that I'm blunt. Rick, he makes me look like Smurfette. Like literally, like nothing compared to him. He will tell you, and he is very blunt. But I like the bluntness. I like the straightforwardness, and that's just the way I've always been. I don't like two-faced people. I don't like people who are kind of sweet to your face and you know all that, and then they behind their back they're like, wow, you know what I mean? I would rather be like, oh, okay. Okay, well, here we go, you know. And so some people don't like that. What are you gonna do? You know, what are you gonna do? I mean, as far as like, what can you say? No matter what you do, you're gonna hurt somebody's feelings. You're gonna offend somebody. So you may as well just be yourself, and that's all I can be is myself. And I think I've done fairly well being myself. Myself got me legitimately on my own 26,000 subscribers, thanks to you all, by being myself. I'm doing something right. Pat says, have a wonderful night. Enjoyed everything today. You're such a pleasure. Can't wait to get back again. Alrighty. So I'm going to go ahead and call it a night. But thanks you guys for being such a great audience. I really appreciate it. And thank you all for being here. I hope you all have a great weekend. I will be back again for a show on the 22nd, but it will be pre-recorded, okay? This was just a bonus today. You know, like I said, today was a good day. If you have something that you want to see as far as like a topic for a show, you can leave it in the comments. And you know, if I haven't done it in a while, or if I want to do it as far as like during the week or whatever, I'll let you know. So that way, you know, you can look forward to your show, your response to your show. Alrighty, so I'm going to go ahead and wrap this one up. Thanks again, guys. Y'all have a great night. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.